Okay.
you.
Okay, so we have established a quorum. There are 5 of us here, so that's a quorum. And I have to begin by reading this script, so that's why I thought we can wait for other people while I'm reading this script. As a preliminary matter, this is Mary Ann Easley, Chair. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me, or hopefully they'll be here soon. Members, when I call your name, please respond in the affirmative. Allison Forsgren,
Here.
Diane Flaherty,
Here.
Vanessa's not here, Kendra Lockley.
Here.
Judith
There.
Perkins,
Somewhere
Susie Stern, not here. Linda Williams is here,
here,
and Mary Ann Easley is here. Staff.
and Judith is here.
It's
Oh,
Jude,
Jude,
Judith or Susie?
not here at the moment.
I'm here.
Oh, Judith is here. Okay, great. Staff, when I call your name, please respond in the affirmative. Jericho Mealy,
In attendance?
Laura Stewart.
Here.
Great. Good afternoon, everybody. This open meeting of the Council on Aging is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth, due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public meetings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded, so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public access. For this meeting, the Council on Aging is convening by video conference via Zoom app as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and to take care not to screen share your computer. Anything that you broadcast may be captured by the recording. Meeting materials. All supporting materials that have been provided members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Before we proceed, just a few reminders. Remember to mute your phone or computer when you are not speaking. And also, could you be aware if there's a person in the background talking or a dog also barking? Please remember to speak clearly and in a way that helps generate accurate minutes. And that's it. So could I ask somebody right now to volunteer to take any minutes of the meeting that occur after 2:20 when Diane has to leave? Would somebody be willing to do that?
Kendra, you're muted.
I can try.
Okay, thank you, Kendra, for doing that. Okay, so she's not leaving till 2:20, so
Okay.
as long as you're aware of the time, that'll help. Okay, now on to the agenda. Well, actually, I forgot approval of the agenda first. So everyone should have received the agenda. Can I get somebody to make a motion to approve it?
I motion we approve. It's Allison.
Thank you. A second?
I second.
I know I'm supposed to do a roll call on this. Okay, let me do a roll call. Just maybe we've caught a few more members. Could you please note the affirmative or if you're opposed? Allison,
Yay.
Diane,
Yes.
Vanessa,
I'm here.
Kendra,
Yay.
Jude,
Yes.
Susie? Absent. Linda?
Yes.
Mary Ann, yes. So we've approved the agenda. Next is the approval of the minutes from the last meeting of March 3rd. Can I get someone to make a motion to approve those minutes?
So moved.
Can I get a second?
I second.
Okay, so Diane, that was Linda and Jude.
Thank
And
you.
are there any comments? Because I have a couple of corrections I'd like to make, Diane.
Yeah, I want to make a comment. Your name was spelt wrong. I put 2 R's in one spot, so
Okay, I'd also like at staff present at that meeting, which is up near the top, Jericho should be listed. He was also there.
he wasn't listed?
Jericho was as part of the staff that was present
Oh, I don't know how that,
with Laura.
I don't know why that wasn't, it was in my, okay,
And his name is spelled without an H in a couple of places it has an H. And Mary Ann Stanton's name has 2 N's in the middle. So those are my suggested changes.
thank you.
And I'll have to do a roll call vote to approve these minutes with corrections.
Yep.
So I'm going to go down the list. Allison,
Yes.
Diane,
Yes,
Kendra,
Yes.
Jude,
Yes.
Linda.
Yep.
Mary Ann, yes. Okay, the minutes of our last meeting have been approved with a few minor corrections. Now on to official business. The first item of business is the Seniors of the Year 2021. And it might help to start with Laura. Could you give us an update on where we stand with nominations?
We have about, oh gee whiz, 35.
Wow.
Well, some of
nominations.
those are doubles, guys.
Some are doubles or triples.
I
And so
know
that
some of
means-
them,
I mean,
some of
that-
them are paid, which disqualifies them also.
some of them are what?
Paid.
Like
So
who?
Mary Ann wrote a, something to send out in an email to the people that nominated people when their volunteerism was really their job. So I went through all the nominations, sent that email out to everybody who nominated somebody who was basically working instead of volunteering, to let them know that they really need to be volunteering and to please get back to me. A lot of the nominations just said, oh, he's a great asset to our community, but didn't explain why. So I sent the same email to them saying we needed a lot more information, and I have not received any back, which I think is weird. So they'll, if nobody corrects themselves, there'll be quite a few that we can just toss out because of those 2 reasons.
I guess I'm wondering if there's something we should, is 35 nominations enough for us to work with, or should we do something to encourage more participation in the nomination process, such as even putting an ad in the INM or an ad on Daybreak?
I don't want to have to pay for that, though. We'd have to pay for that.
That's correct.
And I don't, I'm not all jumping all over that.
Bill
David, you
Farrell
wouldn't have to.
usually
I mean,
just
have
put
we,
something in.
You have to pay for Daybreak?
no.
Well, yeah, you do. You have to.
You
he
do
put
have to
out-
pay for an ad on Daybreak, yes.
Yes, yeah, he put out that whole advertising thing last week.
Well, maybe he'd do it for free. Sort of like a public service.
He will
You'd have
not
to
place
ask
an
him.
ad for free.
No, he won't. He already went through that last week.
I can send him an email and just ask him if he could put it in a little blurb again, which is what he usually does for us. And then it's free. He gets all of my newsletters. So he's done it once for the Senior of the Year. So I could say, you know, we're coming down to the deadline this is what's happening and see if he does it again.
And maybe reiterate that the person has to be a volunteer. Maybe he can spell that out in a little more detail.
Can I ask
And
a
not
question?
part of their job.
How many did we have in the years that we weren't COVIDed? How many people did we have nominated? Is 35 really low?
No, that's high.
Oh,
No, it's high.
That's very high.
so we're not hurting for people then.
Oh,
And how many duplicates?
Maybe 15. You know, some people got 3 nominations, some people got 2.
Hmm.
So do people feel that we have an adequate number, and if we just go ahead and have another daybreak announcement, that will be sufficient for us to move forward and have enough people to consider at our next meeting?
Well, the problem with the ones that we have is that there's no specificity into how they are volunteers. So we don't know how many of the 35, let's say 15 if there's doubles, how many are actually viable because we have enough information. I talked to Laura earlier today. I have a couple that actually are viable. Like Dr. O'Riordan's wife has been out there every day making shots, and she's got to be 75 or 80. And she's out there at the VFW every day because she gave me my first shot. She's still out there.
Who,
Yeah,
Kate?
she's like 70.
Yeah, Kate is out there every.
Oh, no, she
single
is
day.
Steve's age, so she is, yeah.
Isn't she, I mean, is she getting paid for that?
Nope.
No.
Oh,
And then we've got the people that are doing, I've got a call into an email into Sherry Hunt because a lot of the people have stepped up to the plate for Meals on Wheels during this time. So I'm gonna hunt down some that we can actually verify.
Can I, just hear me out, I'll go under the table if it's a booed out, but should we concentrate on like COVID people volunteer? Because it's such a major part of our lives for the last 300 and some odd days, 400, whatever, but is that relevant at all, or?
Sure.
get under the table.
The dogs are there, I can't. But yeah, so I just didn't know if we make it a somewhat of a criteria that.
I have an
Um,
opinion on that, Kendra. I think that COVID volunteers should be put up against people who have been volunteering all along. And perhaps we will all vote for the COVID volunteer having done so much. But I'd like to see everybody given consideration
Yeah,
because
we
some
make
people
that
have been
decision.
volunteering for years and years. And
yeah,
Yeah.
that's true.
Yeah, I would like an equal playing ground for everyone.
Yeah, and we can make that decision when we make the decision as to who gets it.
Right.
Right. See,
Right.
Linda, I told you shouldn't have suggested that.
It's not a bad
There you
suggestion.
go.
all suggestions are welcome and good.
See, you've missed me for 2 meetings, haven't you?
Yes.
Laura, Linda's going to follow up with some of these. Is there something that the rest of us can do to follow up with some of those that don't have enough detail?
I sent them an email. They should send something back. I just went through all of them. There's about 15 that have good answers. And so that's half.
That's good.
That's a lot of people when you guys have to vote on this, it's going to be a lot of work.
Well, if it's half and half men and women, I mean, it's nice to have a,
Yep, there's some men in there.
Do we get to find out who they are prior to us voting? I mean, did you share a list or anything, or don't we do?
I have not. I asked Mary Ann how she wanted to do that because I have them.
And I asked to see if I could see them also earlier today, and we wanted to bring it up at the meeting that if we could just see what's been put in so far.
Well, I'd like to suggest and get feedback from everybody. If you got all of them to review a week prior to the meeting, would that be adequate for you and enough time to look them over 7 days ahead of the next meeting?
Well, I'd like to get them now, but that's just me.
But it's not over to the end of April, correct?
Yeah.
Correct, April 30.
How are
I
we going
think-
to, discuss this when it's recorded and broadcast on TV.
Well, again, I have a suggestion for that. I was going to ask Laura if at the top of each nomination, she could put a number or a letter of the alphabet so that when we're discussing them, we can be discussing, number 5 versus number 10, or A versus Z, as opposed to using people's actual names, which I think is uncomfortable when it's being recorded, especially.
Well, don't we get to go into executive session for that?
No,
No,
no.
no, we do not. So is Linda the only person who thinks that she needs everything today?
Well, I'd just like to see who's in there.
I
see if
wouldn't
can
mind seeing
help
who's in there
verify.
either.
Yeah, I mean, I wouldn't, I can go either way, basically, but I wouldn't mind seeing it if it's,
We don't have to see all the reasons, but if we saw who the people are, we might recognize someone who's not been identified, and not that we can make any, like we can't recommend them, but we could find someone who did.
So you're
Well-
suggesting following up. If you have a name, you're going to follow up, whereas Laura has been finding if she follows up and she gets nothing.
Yeah, that's what I'm saying. We may know one of these people and we can follow up ourselves.
Is that legal?
Yeah, as long as we're doing it on our own and we're not discussing it amongst ourselves, it's fine.
It seems to be more neutral if Laura's following up as opposed to us chasing around people that we may know.
well, what if we shared what we knew to Laura as opposed to, wait a minute.
We can do that. There's nothing illegal about what we're talking about.
Yeah, it seems uncomfortable for us to be following up on certain people and giving them an edge.
No, that's what I'm
just
saying is, don't say
get what we
anything to
can.
them, but say something to Laura, like, I know, John Smith, and I find, maybe you didn't know that he was, shoveling snow for 4 of his neighbors, or, I don't know, if I saw that John Smith's name was on the list, I would say to Laura, I don't know what you have on him as a positive, but I also can add this. And Laura would just look and say, well, thank you, I had that already. But not going to John Smith and saying, does that make,
Yes, well, my question to Laura is, if you sent all of these names to all of us today, then you would get feedback from each of us. In other words, we're not running around the community following people. We'd get back to you with any information we have. Does that work?
Or if we knew who the person was and who nominated them, we could get to the person that nominated them and say, you really need to beef up your.
Nomination, yeah.
Yeah,
That's what Laura has already done.
and if then there wasn't, and also, once again, I think that's letting a little bit, oh, I don't know, never mind.
We know, if we know the people, there's no reason why we can't say, look, you got to give more information, end of story. Because we can do it FaceTime, we can, make it a little bit more personal than Laura trying to hunt everybody down who nominated. Some of us may know the people who nominated them, and we can just say, look, you need to put in more information. We don't have enough. End of story.
Yeah, I
Well,
don't think
that's
that sounds relative, that sounds reasonable. Just
That's
talking to
relatively
the
benign.
nominator, not the nominee.
Yeah, it's benign.
We still have to stand that they can't be paid individuals. They're
Yep.
not qualified. Isn't that true?
Yeah.
That's
Because
true.
I guess I'm a little uncomfortable with, I don't know. It hasn't closed to everyone. I don't know what I'm thinking. But it's something about it just makes me uncomfortable. I mean, why would we be
We're not
giving-
closing on this yet. We're just looking,
No,
and then there's more people coming in on the 30th. We just have a
Right.
jump start on,
But if they've been nominating with qualifications and we're not supposed to be part of it, I don't know why, if we're adding thing, I don't know. I've not ever done this before, so.
Well, we
Oh,
try to get how they benefited the community. That's part of what we require. How have they impacted the community? What are they doing to further elder
Okay.
affairs? And if
Have
they
we
haven't
not-
put
have
that
we
in there, we
made
don't,
that
we
clear
can't do
enough?
it.
We have made that very clear to people.
Yeah,
So if they haven't followed up on it, why are we prejudicing people by doing
know.
their job?
we're just telling them if they've got a reason why they nominated them, we need to know what that reason is, period.
Laura has done that.
Laura,
Yeah, but we know the people that Laura doesn't necessarily know that nominated people, and we can simply have a conversation saying, you got to put the reasons in. End of story. We're not campaigning. We're just saying we need more information if you want to do that. There's nothing wrong with that.
I feel that's been done and that it has to come from somebody they know should not make a difference.
Well, it will. That's just the way people are. We
That's-
can't preclude that.
I guess I'd like somebody to make a motion about what you think the next step should be about this, and then we'll vote on it. Does somebody want to make a motion about
Well, I'll make a motion that.
providing us the names
Yeah.
and us following up with some of these people who have not provided information? You want to do that, Linda?
I'll make that motion.
Make the motion clearly, please, so I can write it
Wait a
correctly.
minute,
motion.
Laura
Raise
has
your hand.
something to say first.
How about if I call these people?
Okay.
I'm not on your board, but I feel uncomfortable having you guys go out, and I think it should just be me. I know all these people,
Okay,
and I just think that being kind of called by other people, I don't know. I have the same thing with Diane. I think it's a little weird.
So Laura, what you would do is just call the people that nominated these people.
That I have already emailed, and they have not emailed me any
Responded.
more specific reasons.
Right.
And
if you'd
just
like to be
reiterate.
considered,
Yeah, I think that that's appropriate for Laura to do it. I don't think we need to have it more than 7 days in advance. And if we don't know somebody or know, whatever, maybe, oh, we can't talk to each other. Maybe we could talk to Laura or something about it. I mean, I don't know if there's an advantage to knowing now as opposed to maybe, or maybe split the difference and let us know April 20th.
But don't forget, some of them are going to come in April 30th, so you're going to have another.
Yeah. We just have a heads up, maybe a step up on it.
Okay, does somebody want to make a motion here?
I'll make a motion that Laura will follow up with some more phone calls. I guess I don't,
We don't have to make a motion on that, guys.
okay. All
We
right.
just.
Okay,
just
so
start.
Laura is going to follow up with more phone calls,
Yeah.
Yes.
and she
Can I-
will provide all of the nominations to the Council on Aging members 7 days before the deadline. And at the deadline, any additional ones that come in. Also, Laura will contact Daybreak to see if she can get them to do a reminder.
Are we getting just names, voting on names? Are we going to get their info?
No, we get the info. We can't vote on anybody without info.
Well, shouldn't we get that before 7 days or?
That's what I'm saying. I'd like to see what's in there right now so I can just start thinking about it.
Well,
That's not
I
right.
don't know how much time we need to think about it. We're not going to run around the community. We've already decided that Laura is going to be the only person to contact any person who's doing a nomination.
But we'll get it 7 days before, not the day of, correct?
Correct.
Okay.
7 days before
April 30th.
April 30th. Thank you.
Any other comments on this subject? The other thing that we have to think about is how we're going to recognize the winners. And at the NCEA meeting, Joe Aguirre had suggested possibly we can even do some sort of a recognition luncheon in the summer or in the fall based on any COVID rules that happen to be in existence at that time. So I'm not sure if people want to weigh in on this subject now, or if we should wait until our next meeting and discuss the recognition.
Can I make a comment? So they get recognized. What day is it that they get recognized on?
Well, we'll vote we'll vote at our next meeting, which is May, our first meeting, and we'll
Right.
announce right after the vote.
Right after the vote. So is there something that we can do to, like have a photographer there, have a social distance from each other, present them, with this honor? I mean, I think, we got to do something.
That's what we normally do when we when we did it at the fairgrounds. Here's your plaque. They did a speech. We did a speech. Yeah, there's a whole big ceremony to this.
Well, maybe we save the ceremony until the NECA's luncheon, and then, but in order for them to be recognized.
I think a photograph's a great idea. The people who win get a photograph, go in the paper, and then the recognition luncheon will be, when it's safe to gather.
Oh,
Yes,
I could do
Yeah,
it,
absolutely.
make
Oh,
like
that's so
a
good.
little cake or a little cookie plaque or something fun like that, so they could have flowers and a plaque, something a little bit more oomph than they would.
So
Have
usually,
something delivered to their house.
once
Well,
you guys
whoever
vote-
sorry.
once you guys vote on it, Mary Ann Easley will contact the INM, and they will go out and interview the recipients. And their picture and their interview will be in the newspaper.
Will anybody, one of our representatives be there, like Mary Ann Easley, would she be there with the INM and to present? Or whomever? From
That
COA?
is up to Mary Ann. We always do a certificate that is signed by COA chair, NCEA chair, Libby Gibson, state representatives. And that might be it. So they get a certificate that I make up and everybody signs it. Usually we give them, I don't know, maybe it's a $25 gift certificate to a restaurant that is usually paid by NCEA, which is how they support the Council on Aging. And they would also pay for the meal if and when that happens. So they would get a gift certificate and they would get a certificate, framed so they can put it on their wall. The only thing that we're missing is the party.
Well, do you think we should give the certificate at the party and just have the interview?
Well, usually that's what we do.
Yeah.
We don't know
an
when that's
MC.
going to be possible.
That's why I'm thinking that maybe something that might not be the certificate or the plaque, but something fun and to recognize them then, and with the connotation that you will be receiving a real recognition document at the party.
Kendra, do you want to make some cookies? Is that what this is about?
Yes.
I like the idea.
I know you know me, the way to everybody's heart and love and kindness is through their stomach, at least for
I
mine.
agree with that. I would love to get flowers and cookies delivered to me as kind of a nice surprise if I won this.
Yeah, and I'm just jonesing to come over anytime. So, I mean, I got nothing going on here, girl, so I'm happy to bake.
Don't admit that.
Laura, I also wonder if it's possible for the winners to be at the select board meeting and be noticed by the select board and also get something from Libby at that event.
Oh, that's a great idea.
Jericho
Nice.
question.
All right, know that the selectmen are meeting by Zoom also, guys.
Sorry, I heard a Jericho question.
Yes.
I'm sorry, I didn't hear the
At
actual
the
question.
select board, they want to know if the recipients can be at the select board meeting to get recognition from Libby.
Yeah, I don't see I couldn't imagine there being a serious problem with that. I will investigate that with Libby real quick. Roughly when this would be the one in the fall, or do you want to do one right after we do the announcement?
Oh, I
In
would
May.
suggest in May,
May.
because we have to wait for this event. We know that the event is going to be put off. So anything we can do right away to recognize these people, it seems we ought to. Move on it.
I can definitely mention that. I'll send an email with that actually when we get done with this particular meeting.
Thanks, Jericho.
No problem.
Right, so interview with the newspaper, select board, and cookies. right away and then party after, right?
Yes.
Okay.
The only other thing that comes to mind, there is going to be an in-person outdoor annual town meeting. I don't know. I'll when I talk to Libby about that, I'll see if there can be any kind of recognition
Oh,
there as
that's
well,
Great
possibly.
idea.
I don't. I know that plans are underway for that, so that's less likely than a select board acknowledgement. But I will mention that to Libby in the email.
Thank you,
Nice thing
Jennifer.
about a select board acknowledgement is that many people are tuning into the select board that usually don't, I think, and it would be a nice place to recognize them.
Maybe before at town meeting, at the beginning of town meeting, they would honor some people. I know my husband got a honorary mention for 10 years of service when he was on Park and Rec. Maybe at the annual town meeting, they could be recognized at the beginning of the meeting, just maybe verbally, rather than having to be there.
They have been, haven't they been in the past? I think I remember that.
You know, in the beginning of the meeting, after they do the pledge allegiance and the scouts come out and.
Yeah, good idea. Jericho, could you add that to your list? Thank you. Anything else on the subject of seniors of the year before we move on? Okay, so don't forget, everybody, you got to be at the next meeting so we can make our decisions. Very important meeting. Next is Jude with an update on the Inquirer and Mirror column for seniors and about seniors.
Okay. Mary, I've been in touch with Mary Ann, who's very excited about it, and thought, I thought she was going to put a classified ad looking for writers to submit. She didn't yet, and I got back to her and she said, here, I'm trying to read her email. It's her April goal to find somebody this month and to please send any interested people my way with a sample column. I'm still not clear whether she wants to keep, it sounds like she wants one writer on this all the time, rather than just varied submissions. I was in touch with Vanessa at Sherburne and Donna something at Landmark House, and they put notices in mailboxes for their residents about the idea of a senior column, and if anybody had interest in writing, to please get a submission to Mary Ann. And that's as far as we are right now. She's definitely, Mary Ann is definitely excited about it. And that's all I know.
So Jude, I have a question. Did you give her the draft
I
draft
gave
that I
her
did?
your drafts. She liked the info in them, but didn't feel like that was like a human interest column. She thought it was more newsletter informative rather than, I think, what she's looking for in I don't know, like a more newsy column, like Sarah
What's happening
Chase
this week kind of thing.
stuff. What'd you say?
What's happening this week kind of thing. What's going on type of thing. That's what she's looking for.
But Mary Ann, your info that you sent her was awesome because it showed, I don't know whether it was the demographics, I don't know how to describe it. It just showed how many seniors are here, the importance of the seniors, and info on seniors. But it wasn't, she didn't think it was a pushable story kind of thing.
I've got an idea.
What?
I'd be willing to write about being an infant Salt Marsh member, being 60 years old, and the joining process. I mean, I think that, until we find somebody that's going to do it on a permanent basis, to start now with, you know, if she thinks that that's interesting. I mean, until we find somebody, it seems like a waste to not have something in there. You know, I don't
Write
know
it.
what she wants. I mean, I don't know if, you know, I don't know what she's thinking, but
I
it
think
would be
she
nice.
said 365 words, something on that effect.
Isn't that a lot?
Yeah, I think it is.
Plus also, is she gonna be looking like, I mean, I don't know you know, the background of this, so again, speaking out of turn, is she looking for like a journalism type of person to write this, or I mean,
I think
it's gotta
so.
be a writer. I mean,
I-
is she looking like, okay, I saw Jude Perkins the other day and she had made herself a beautiful sweater. I mean, that type of, no.
No,
No.
she's looking for a writer, and she wants someone who does not mind being edited, and the criticism of both Marianne and Josh Balling, the other editor or associate editor. And there's a pay, I think she told me, 125 per column, not written column, but per, and you know, per entry, and twice a month, she was thinking.
Yeah, that's what I have in my notes.
Okay. And yes, anybody who wants to write, they can be young, they can be old. It's just something that would grab a senior's attention and does not mind submitting it to the paper, and, you know, they don't mind not, you know, not, she'll respond to you, but they're not gonna take everything.
Is she gonna give you the subject to cover every 2 weeks, or we're gonna have to dream it up?
No, I think you dream it up. I think you take it and go.
But Jude, it sounds like this, Mary Ann is going to hire someone, if she's going to put an ad in the paper, and then she's going to be in charge. So,
Yes.
yeah, she will hire someone, and the two of them will work out how it will go from there. So I don't think she's looking for us to submit any more ideas.
No,
She's going to hire a writer, that writer will be in charge.
right.
Yeah, that's what it sounds like. Well,
But I'm not going to let go as far as keeping in touch with her to make it happen.
yeah, great.
That's our duty, or, you know, I'll take it on as mine too.
So, do you want to see if she'd be interested in how to get started at the Salt Marsh as
Why
a new
don't you
member?
write and submit it?
Well, if she doesn't like the idea, I don't want to spend the
Well, and
time doing
Well,
it.
just email her then, because
Okay,
she's definitely excited to have it, and I think, and she responds right back.
I mean, I'm trying to get all my friends to join. So,
Yeah. It's M Stanton at,
oh, I know.
We both know.
Yeah.
but the good thing is she does want to do it and will be doing it.
Right.
This person can be off island too. I mean, it could be anybody. I'm sort of disappointed it was not in the paper the past 2 weeks, because she had mentioned it a couple weeks ago. And I didn't want to be pushy and say, I didn't see it, but
so is it specifically aimed towards the seniors?
I
Meant
think,
to be?
I mean, I think that's what I presented, that it would be a column, a senior, I don't know how to describe it, a senior column. And then Mary Ann submitted all this information that just shows the need of, I mean, there's so many seniors here, and there's no column that is
Well,
particular to them.
Can we get Mary Ann's column in the Gazette?
What?
The Salt Marsh Gazette? I mean, it sounds like it's a, you know, just because it isn't what Mary Ann wanted, doesn't mean that everyone else wouldn't want it. Right, Loki?
Well, Laura is the editor of that, and I would have to say the Gazette is more news items, and
Yeah.
I was actually trying to write a column.
Oh, okay.
It's just that I was writing kind of a launching column about, here's why we're doing this column, because there are X thousand seniors on Nantucket, and here's how the breakdown goes, that sort of thing. So it sounds like she wants something more newsy.
Yeah, I mean, like here, people don't know about the island ride, or they don't know about, something, what services are here, or what's going on this week that they may want to go to the Artists Association, because I'm involved with one of their programs. So there's all kinds of things out there for seniors, or just how to deal with an Alzheimer's person at home, or what's available for people to go in and babysit while they get out of the house. There's all kinds of situations here and all kinds of activities that they can still do safely.
Yeah, it sounds like Mary Ann knows what she wants, and she's going to hire the person to give her that.
Right,
That's like the bottom line.
right. I agree with you. And, she's probably going to talk to people at Sherburne Commons, at the Homestead, different get feedback from everyone. That's what I'm getting from this. I don't know if
Yeah.
that's true.
It's in Mary Ann's hands, basically,
Yeah.
to hire someone.
Well, Jude, thank you. From me, I thought that was exciting. I'm glad that you carried through with that. It's been pretty positive.
Yeah, I think it'll be good when it happens.
Yeah,
Surprised
thanks
that-
Jude, for staying on top of this.
And Mary Ann, thank you for writing that.
I know.
Article.
I wish it could be published.
Maybe we'll have a shredding ceremony.
I'd like to read that article. Can you share it with us?
Sure.
Yeah, that's pretty, yes.
Yes, that would be nice. to share
Would
with
would you
everyone.
do that? Would you be willing to do that?
No problem.
All right, thank you.
Thank you, Jude, very much. This should
Yeah.
work out
Yeah, thanks, Jude.
something great in the end. Good. Jericho, are you still with us?
I am indeed.
Oh, perfect, because you're
Oh,
next
look
up on the agenda.
I'm up. What did you
Hey.
guys think? I just like left a still picture up there?
No, it's just, you're still looking like you're in on another planet, so,
I think I
Um,
am.
Can I just say something, Jericho, before you start?
Of course.
I have to leave soon, and I'm sorry I left your name out. I don't know. I
Don't.
rewrote it several times, and I don't know how I left it out, so
It's
I
okay. Don't
I
don't worry about it at all.
apologize.
It's quite okay.
Maybe I was out in space too. I don't know.
I'm right. Let's see. Where did I put the agenda? I guess it's just COVID task force related information, human services report. COVID task force. It's not good, I guess, is the general state of affairs there. We just got our sewage tests back for the week, and they are still going up. We are moving more to an outreach based approach in terms of managing job site safety, et cetera, et cetera. The previous enforcement based one wasn't working quite as well as it could have been. We are also branching out into a lot more the increased eligibility limits make it so that we're working a decent amount of my time and effort is spent incentivizing and encouraging people to go get vaccinated through education and through improved access. That's actually been the biggest thing that I've been working on here is finding ways to help people who don't have as much computer support or maybe language support, making sure those people are able to get themselves vaccinated as quickly as possible. For human services stuff, I think the CRC grants, the human services related grant process has basically just wrapped up. They're going to be announcing the grant results for this fiscal year. I think if they haven't already, they will be this coming week. Basically, there's an expansion in services for behavioral health, specifically addiction and I think isolation would be the best way to put it. Some increased re-socialization efforts. Shit.
And this is money coming from where?
These are grants from
Contract
the
Review Committee, which I'm on.
yeah, the CRC, the contract review committee.
And so it's not Title III as,
These are not. I don't believe these are the Title
No.
III funds. Linda, you're on that, right?
Yep.
Yeah, I haven't been able to make it to as many of those meetings as I would have liked.
There are
but,
grants that have been going on for decades. Anybody who's been to town meeting back in the 70s and 80s, we used to vote at town meeting every year on a grant to the Athenaeum, or a grant to Human Services, or a grant to NAMI, or a grant to whatever was around back in those days, the hospital. And they decided that that was just chaos.
Cameron?
So they then created the Contract Review Committee, I don't know, 20 years ago. And the funding comes through our committee, and then we make a recommendation to the selectmen as to, we got about 650,000 this year and last year for Human Services. So NAMI gets money, ASAP, which is now combined with NAMI, visiting the guys that deal with the disabled kids that come from the Vineyard, mediation
Legal.
through the courts.
Yeah,
I
the
think
legal
there are
services.
12 in the hospital, as well as Fairwinds, as well as,
Gosnell dropped out. That's right.
yeah, no, as well as the birth control. What the hell is the name of that place?
Planned Parenthood? No.
Yes, it
Can
was
I just
Planned
interrupt you?
Parenthood.
Can I interrupt for a second?
That's where the
Because
money
Diane-
goes.
This is Mary Ann. Diane has to leave, so
Yeah.
Kendra, can you take over minutes?
Yeah,
Kendra,
she got it.
Yep,
She's in the. She
got it.
she got it on the chat. Thank you, Diane. By the way.
sorry.
Thank you.
So that's pretty much what the money we're talking about.
Yeah.
We give 650 grand away a year now.
I think there's some of the money there is going to help the there's a few senior related organizations that are getting funded, and then the behavioral health organizations are getting a solid amount of funding
Yeah.
to help cover the sliding scale
Or
behavioral
the
therapy.
ambulance to take
yeah.
people off island from here.
Did I can't quite remember if our island ride wasn't asking for
No,
CRC funding.
that's done through NRTA funds
Yeah.
for the state.
And then let's see what else. Laura is currently she's getting the reopening plans for Saltmarsh together. I'm gonna take a peek at those. We'll do a little bit of editing. I'll take them to Roberto, and then we'll have a solid plan for the opening of the Saltmarsh whenever that ends up happening. There won't be any official decision on that until we're a little closer into the summer. The earliest it could possibly open up would probably be June. We're still looking into, there's some, oddly enough, Laura, on a couple of DPH calls, there's been some discussion, Department of Public Health calls, there's been some discussion about vaccine passport and ability to restrict entry to the to senior centers, specifically over vaccinated or non-vaccinated status. There's apparently some interesting legal concerns, as well as a lot of like practical, how do we execute, like how do we implement that particular process. And then it's going to depend on both the state's state of emergency and also the various orders as they're changed and adjusted leading into the summer. Both the health code, and then I believe there's some local gathering restrictions that would apply. That's more or less it in terms of what I've been up to for the last few days last month really, with respect to COVID and with the human services stuff. Does anyone have any questions regarding COVID or human services elements? It could be anything COVID related, vaccine, whatever.
If I never hear the word COVID again, it'll be all too soon.
God, I know.
And you do realize you're not supposed to call it vaccine passport.
Yeah, no, I know. There's so many different things that we're not supposed to.
I know. I have a question. What's the status of Nantucket as far as percentage of people being vaccinated?
It's really hard to tell percentages because we don't know what the population of the island is. We've got about 5,000 first doses in. That's probably going to increase by around 1,000 a week until mid-late summer, assuming that we don't have any changes in the supply chain, which we're really hoping they will. But the I would say right now at 5,000, that's probably going to be, depending on what number you use for year-round residents, that's on the order of about 30%, 32%, but that is not definitive at all. We don't know how many people from who have come here in the last month or so that have been vaccinated or not been vaccinated. We're also getting seasonal workers who are extremely unlikely to be vaccinated. So it's going to be kind of that's a big question mark. I think we're pretty confident to say that the senior population on the island, those who will accept the vaccine, have had an opportunity to get vaccinated. And I think the remaining eligible people who are not vaccinated are people who have, at least of the higher age categories, probably 55 up. Well, most likely 60 and up at this point. If they have not been vaccinated, it is a personal choice to not get vaccinated, and not a lack of opportunity. We do expect supplies to be constrained pretty heavily for the next, well, hopefully only for the remainder of this month, but when we do get an increased supply, I think you will see the island vaccination percentage increase, as well as I think a lot of the regular people who come to the island during the summertime are going to be heavily vaccinated. So I can't give you like a straight up and down percentage right now. I would guess somewhere about 20% of the island's year-round residents have been vaccinated at this point.
Thank you.
You are aware, I picked up 2 people yesterday from the boat. You're aware that there's a lot of people coming here from the Vineyard, the Cape, and Boston to get their shots because they cannot get appointments over at the
Yeah,
other places. I picked up some yesterday. There was for their second shot.
they're
They
going
came
straight
over.
out to the VFW.
Yep, and these people are okay because they're all registered at Mass General.
Yeah.
So wherever there's a testing thing, you can go to get it. And there are a lot of people
Well,
coming
you're
here
on-
because they have
Yeah, if you're on-
availability.
If you're on Patient Gateway, the Gateway thing, it tells you, make an appointment here or here or here.
Yeah, and they're coming, a lot of them are coming here. There's a huge amount coming here to get their shots.
It's definitely spiked in the last, probably last 2 weeks. Laura's been running a reminder call center type program for off-island people. And I think, Laura, like the biggest day you had was something like 70 names, 80 names. So a little under half of a day's vaccinations can be off island, which is why it's really difficult for us to break down the island's vaccination percentage. But I think the earlier categories was a lot less off island people. I think it was when you had to go through the town sign up process, that was a big limitation for off island people. But
Absolutely. But not now.
no,
My brother's
now
coming
it's,
from Portugal. He moved to Portugal last year and he's coming, he and his wife are coming from Portugal because they can't get shots over there. So they're coming to my uncle's house.
yeah, I know. The positive side of that is that we will be able to vaccinate seasonal workers, and seasonal workers are a very significant part of the island's epidemiological health. So being able to get them vaccinated is good for everybody else by extension, because that's high risk vectors. And also,
I agree. I think everybody, get everybody vaccinated.
Everybody.
we just need more. That's all there is to it.
Is the
Well-
supply bad?
It's not bad, but it's not improving as quickly as we want it to. And we're hitting the point now where we have to do second doses for a lot of the people that we vaccinated the first time around, which means that net increase in number of vaccinated people is not increasing as quickly as we'd hoped.
Mm.
Basically, a month out of everyone's first dose, they have to come back for a second dose that eats into the available number of slots for
For the
first
first
doses.
dose? Oh, and
Yeah.
yeah, I'm on tomorrow for my second. So
I mean, and so we also been using 2 different vaccine streams. So we've been using both Moderna and Pfizer. Pfizer has a 3-week lag. Moderna has a 4-week lag for second doses. So
Oh.
if we don't have them scheduled correctly, they overlap and they're taking the same appointments, which then reduces more first doses.
Oy.
It's a nightmare of a high school word math, like word problem in math class where it's
Right. The
you
train
can't-
leaves Chicago. Yeah.
How is the volunteer? There's been ads for volunteers. How's that
Um,
going?
we within about 4 days we added 27 volunteers. for non-clinical tasks. Heather Francis, previously of OIH and now our public health nurse, she's been helping manage, schedule, and kind of run down volunteer support out there. She runs basically half of each day's clinic with the expanded hours. She's sort of running it out there, covering scheduling issues, getting volunteers slotted in rather. And then she's also added quite a few, like we're starting to make inroads to get full-time interpreting and translator volunteers out there for non-native speakers of English language. We're doing, there's quite a bit of work there. The turnout, both on the clinical, like the vaccinator side, and on the non-clinical side has been really good and looks to increase as time goes on. So that the volunteer thing has been a pretty constant, pleasant surprise for me. Basically, since I started this position, people have been reaching out to help pretty much from day one.
Nice.
Now, I know COVID has a tendency to take everything over, so let's wrap this up. If anyone has any other COVID/me questions, I'm going to be quickly answering them, and then we'll let Mary Ann get back to running things. Okay, sweet.
Thank you, Jericho. Appreciate it. Laura?
So things at the Salt Marsh are running well. We're getting a few new fitness participants, which is nice. People must be coming back from their winter hiatus. So everything's basically status quo. We did get an email yesterday that CFAN got more money for their emergency food fund, and we will be doing foods at least through the end of this month.
I'm sorry, what was it?
The meal program that we're doing.
Oh, what did you call it short? The CFAN? What?
Yes, Community Foundation of Nantucket.
Okay, thank you, sorry.
Yep, that's okay. They got more money, so they are expanding, and we're going to continue at least through April, and they're going to see from there. So that's fabulous because it's great. We do about 70, it's kind of the same every week. We do about 70 people, and it switches back and forth from who remembers and who doesn't, but it's nice to see everybody and chat with them for a little while and catch up with them, and it's perfect. So my thought for when this does end is that maybe the Council on Aging would reach out to NCEA to see if they would like to ask Nantucket Catering Company if they are willing and have the time to do what we had done at the beginning for our drive-throughs, just like a muffin a week or maybe a half sandwich type of thing, just to keep it going throughout the summer. Just in case we don't open, and if we do open, we'll probably have 10 people in here at a time. So it's not like everybody's going to be popping in. So just a thought for the Council on Aging. And I don't even know if the catering company will have time, because I know they're busy and, allowed to do more than they were last year.
There's a bunch of little smaller ones, then it might be too small that they can't. Do you pay them, or do you?
Well, that's NCEA would pay for it.
There might be.
NCEA is not paying for the meal program now. So with CFAN, it has to be hooked up with a nonprofit. So that's why NCEA is part of it. So NCEA pays for it, pays the catering company, but they are reimbursed by Nantucket Community Foundation with their grant money that they receive.
Oh, right, okay.
So NCEA really isn't putting any money out now. So don't feel bad about that, asking, because they might have money that they're willing to shell out. It was great when we first did like the coffee and muffins.
Yeah.
It really was just fabulous.
I'm sad that.
Yeah, so now that Kendra's moved off island, and we have our little hooks in Nantucket Catering Company.
Oh, good.
Well, they're the ones that are doing the meals for our program through CFAN. So it might, you know, and it might not work. Maybe we'll just be buying muffins at Stop and Shop. Who knows? But anyway, something for you guys to talk about and see if you'd like to do that collaboration again between NCEA, COA, and the town.
I would say yes, and definitely we can go to NCEA and ask for money. Not a problem.
Yeah, they seemed very willing to do it the first time.
Yeah.
So I think to continue, especially since we just don't know what's going to happen this summer. And it
Right.
would just be nice to still see everybody.
Yeah.
Yeah, so that's kind of all that's going on here, which is a lot, but, and doing lots of phone calls, you know, as Jericho mentioned, to confirm everybody coming from off island, so.
So Laura, how many people is anyone availing themselves of the computers that you have?
We lent the tablet out once.
Wow.
Yeah, we lent it out twice. She returned it because the library gives out actual laptops. And they're just so much easier, I think, well, at least for this person to be, you know, it's got a keyboard and it's just a lot easier to use than all these little apps here and there. They don't really get that. So we're still advertising for it. We haven't, you know, been able to utilize it, but once we are open and people can come in and use our
that's good.
Wi-Fi and just hang out and, you know, check their, or whatever they want to do, you know, hopefully we'll have them available for them.
Yep.
And it was great when we had construction going on, because when the IT had to come in and take down all our Wi-Fi and computers, so we couldn't do any Zoom, but we have a hotspot thanks to Jericho on the two tablets. So we could continue to Zoom through that hotspot, which was fabulous. So that meant a lot. So, any questions about anything?
What construction? Sorry, that's an off.
Actually, Laura, you might want to just give an update on where things stand with the improvements to the salt marsh, because a lot of those suggestions came from Kendra and she hasn't been here to hear about them.
Right. So they put in a new flooring, the same flooring that was in the great room is now in the lobby, the hallway, and the 3 offices.
Oh, wow.
Yeah, so it's all one flooring, and they took out the sliding door and are in the process of waiting for a permit to put up the new divider that will be there.
Oh, so they took out those sliding,
Yep, they took that out, and now it's all going to be windows and 2 doors that open. They have to open both ways.
right, yeah.
I could think because the town, you know, the building department wants it one way, but we want it another way. So they're going to do both so they can stay open. You know, they have to be fire doors and ADA compatible and all that stuff. So I believe we're just waiting on the permit for that. And then they'll put that in. They're going to repaint, and they're going to put a new ceiling, or put a ceiling over the ceiling in the great room. I guess they can't take that down because it's so old and it'll just.
I got asbestos.
Yeah, well, I don't think it's asbestos. I think it's just
It'll
easier
crumble.
just to cover it up.
Yeah.
If it was asbestos, we wouldn't be in here.
Right.
So it's just gonna crumble and whatever. So they're just gonna put another one on top of it, put in some new lights, and I believe new fans. So they better hurry up, because if we open in June, we're not gonna be ready. So it's been a lot.
Good.
So yeah, it's looking good.
Thank you, Laura.
You're welcome.
Appreciate it. Allison, you have the next 2 subjects on
Yay.
the agenda. Yes.
So it's been enjoyable working with Lizzie at the Artists Association. She's the director of adult programming. And they really took the ball and ran with it. They already had they had applied for some funding for programs for senior citizens. And when we couldn't come up with a specific program of crafts for seniors, because I had been speaking to them about instead of having fine arts like watercolors or things that were intimidating to people, because the feedback I got around Linda Zola's classes is that a lot of people didn't feel that they were artists. And so the participation in that was very slim. So I have been speaking to the Artists Association about having like, there's a makers group going on right now where Leah Jensen does pop-up cards and, she has something different every week. But anyway, they have offered a 50% discount to seniors on Nantucket who sign up for one of their existing programs. So they just put out the spring program list, and except for ceramics, people can sign up by calling Lizzie Congdon or Maggie at the Artists Association for a course, any course, and get half off. So I'm not sure, we all want to have Nantucket residents, Nantucket seniors be available or to get these, to be able to afford themselves of this before the general public. For instance, the Palm Beach, the people that come from a distance for the summer that may or may not be as needy for the discount as some of the people that are here. And so she reached out to Laura and the Salt Marsh and Sherburne Commons first, but it will eventually be advertised and anyone in the community will be invited to do them. So I think that's just one semester so far, but we're continuing to look for grant money for that type of art. And we even spoke about doing something especially for people living with Alzheimer's and dementia, that we might be able to get funding from the same person that did the seminars we had last year about dementia-friendly Nantucket. She did the 3, her name, she's an actual art therapist. So they're happy to work with us to do anything at their facility. It's a big, beautiful building with cross ventilation.
Where's this?
The Artists Association.
Yeah, who's the dementia artist?
Her name is
Oh, maybe.
Margaret. I can find that out for you. Margaret Cahill, Cahill. She came over to do some dementia-friendly workshops, and that's her official job as an art therapist. So that's something that I'd like to pursue. I didn't understand what the NCEA was willing to do. I had thought to go to them for a special class that they would fund that would be free for Salt Marsh residents. But Laura, do you know what happened with that? Laura?
Sorry, I was helping Ginny with something. What do you need?
What was the feedback from Joe Aguirre or the NCEA about the art classes? You said they'd only do one or something?
Oh, I don't remember.
Okay, well then.
Yeah, that was a while ago.
Yeah,
I think
Yeah.
I have some email exchanges from around that. Maybe we talked about it at one point, Laura. I'll see if I can remember where I put those notes.
And this is Mary Ann. I thought it was not NCEA, but somebody else was going to get involved in funding that.
I was going to ask NCEA if they would pay, the facility would be free at the Artists Association. We need to pay for an instructor.
No.
What?
Just pay for the facilitator?
Yeah,
Oh,
and materials. And I thought that if we could, have our own Salt Marsh group instead of anyone 60 and over, that would make it a little more cozy for our members. Now,
Was it something like NCEA wanted to make sure that there were enough signups to be able to commit? Kind of remember something like that.
right, and then I made that survey. But then they didn't want to send it out or something. Anyway, we have a trial semester on April and May at the Artists Association. We'll see who participates. It is like $60 for some classes. It's $150 is half price for some of the other ones. So I don't know if that's going to be something that a lot of our people are going to want to do. But I was hoping that by having it be, you know, by offering it to the Saltmarsh people first, that people who weren't in the Saltmarsh and were 60 might join, so that they could participate as a Saltmarsh member and get noticed first. So I'm looking to drive our membership a little bit and get more people in and participating in especially off-site programs through the Saltmarsh Center.
Is there a limit on how many? Because I remember when it was first advertised, it was maybe the year before last, and I signed up for one. I went in and they said, oh no, it was filled long ago, you know.
No, there's a limited number, and so it just came out. Did you read the
Yes.
news?
Yeah.
Yeah.
Noted
So
heavily.
yeah, so sign up for one.
No.
Might as well, you know, before they open them up to people who come from off island. I mean, that's, you know,
But this is also a class with non-seniors as well.
correct, correct.
And how many places are they leaving open for seniors?
They have it, you know, whatever their grant allows, but
Oh,
because it's not just for one class, it's for any class they offer. You know, she didn't tell me how many scholarships were available, but wanted to offer them to the Saltmarsh and to the Sherburne Commons first. So they did that. She's, you know, I'll find out who, you know. Oh, Laura, you also asked if she would get back to you with who they were, right?
Yeah, I'm just curious if they're Saltmarsh members or if
Yeah.
they're seniors at large. You know?
That's what I'd like to find out, because I don't know if Saltmarsh people only want to do free things. Yeah. So that's why I really wanted to get the NCEA to have a Saltmarsh art class, but this is a start. So I like Lizzie Congdon, and I go there. I swing by a lot. I do some makers things there. So I'll keep on it, but they are so happy to work with us.
Thank you, Allison. That's
All
great.
right. And then the next topic. So wait, where's that page? So the Title III grants run in 2-year time segments, and the Council on, well, ESCCI, the Elder Services of Cape Cod and the Islands, is going to be advertising probably by the beginning of next week for RFPs, requests for funding. I'm not exactly sure what RFP stands for, but it you know what it means.
Request for proposal, I believe.
Request for proposal, right?
I just learned that one.
RFP. But there was a needs assessment, and the top, the top things, transportation to medical appointments, homemaking services, caregiver support services, including respite, assistance with technology, social isolation, finding a primary care physician. And so there are 10 needs that were identified. And so they are looking for RFPs for nonprofits that they will then reimburse for services. The only one that Nantucket has and has had for a long time is one through palliative care. It doesn't mean that more people couldn't apply. but they have to be evidence-based programs that help with health and disease. So I don't know. I mean, I'd like to see all of us participate in those. It'll be a Zoom meeting.
Wait a minute,
Hopefully
is this for
soon.
Title III grants?
Yes.
And
Yeah.
why would we participate? Because what are we
Well-
trying to
Well,
learn?
yeah, we couldn't ourselves get them, but the town of Nantucket would qualify. So if we could identify a provider of a service and the town of Nantucket could contract with them, they could be reimbursed under Title III by the state. So it's an opportunity. I mean, other communities get a lot of them. They have people who, you know, I just like to see Nantucket get a little bit more from the state, because there are things available, but the process requires, you know, there's got to be a notice in the paper, then there has to be a traditional RFP application filled out. They're granted the first week in July. That's when they're announced, when the winners are announced. And then they begin in October and go for 2 years. So,
The money comes in for 2 years?
yep, yep.
So this is, writing grants is like, we'd have to hire somebody to do this. I mean, if Nantucket was going to do this, because the requirements that you are responsible to propose in order to do this RFP are huge. I remember for Girl Scouts, we tried to do a proposal for the our Camp DePauchus on Pulpus Road, and we ended up hiring somebody to write the grant.
Well, you know, a lot of people who provide the services also write the grants. For instance, this Margaret Cahill is an art therapist. I don't know whether that's an evidence-based program, but she would write her own grant in order to, so, you know, if we can identify, I mean, shopping services, I think that caregiver support, especially Alzheimer's caregiver support, would be a program that if we could find a provider and complete an RFP, they're reviewed and then granted. So when that, when the notice and for that information comes through, I'll share it with Laura and she can get it around to all of us. But I think that that's, you know, it happens every other year, and it would be great to get some more money from the state to Nantucket for the things that we don't have or can't get from any other place.
And Allison, how does this fit with Sherry Hunt's programs?
Sherry is the Nantucket Elder Services, so she would be integral. She would know, you know, another thing is for loneliness and isolation. So she would know who needs those services and can help us, but she as an employee is not someone that would be writing the requests.
So would somebody, so are you saying that COA would present for elder services to get this grant? I mean, what's COA to do with getting the grant? I mean, are we doing that under our umbrella or NECA's umbrella, or?
It could be NCEA, it could be the town of Nantucket, because municipalities are considered nonprofits for some of these funds. So if we could identify, you know, I mean, there'll be more coming out on this when they, and, you know, she thought by this next Monday. It has to happen via COVID. It's the first year that that's happened. It still has to have notice in the newspaper. So on the states level, or on the state side, it's more complicated than it was before. And Marianne, the person who I work with at Elder Services, is just finalizing that, but it will be advertised. Marianne, did you go with me a couple of years ago? There was a, I went to the presentation at the library when they did this last one, and it was way over my head back when I did it. Maybe it was 4 years ago, but now I know what an RFP is most of the time.
Like what you're talking talking about right now is way over my head. I
I
hope
know.
Yeah, I don't remember going with you, but that might be my senioritis kicking in.
So, maybe,
But I
maybe,
don't know that we can actually identify community needs. That's why I was asking about
that's,
Sherry Hunt.
yeah, I mean, that's what our job is, I think, as a council on aging is, of the list of 10 that came back from their needs assessment, they had to send out a needs assessment. People had to answer it. Then they had to analyze the needs assessment and come up with the top 10 needs. And so those top 10 needs, the Commonwealth will fund evidence-based programs that there's someone that participates and creates and implements the program and is paid by, I'm not sure about the pay thing. All I know is that we should be, looking at what we can identify as programs in the top 10 and be available for the meetings when they happen.
I'm so confused. So when you say maybe, first of all, evidence-based, like there has to be an outcome.
Right.
And what you're saying is that the programs, there's 10 programs that fit the needs of the grant.
There are 10 from this needs assessment survey. There are 10 things that were identified as where we really need some help. So
Do you
those
remember the survey that was sent out like 4 years ago from UMass?
Yes.
Whatever, that's basically the same thing, whatever, came from that, because that had the same type of things. Are you
Right.
isolated? Are you,
Yeah, but
Wi-Fi deprived or?
this is the state and they have to have their own stuff. And they sent it out probably a couple of months ago. And I filled one out. I think Laura put it in the newsletter.
Yeah, I saw that. But wasn't that other survey state too? Or was that?
No, that was
Hired the UMass people, or was it UMass?
Remain and NCEA were the people who funded that. And that was not for state funds. That was for, they were trying to demonstrate a need to have a salt marsh, a new senior center. So that's separate, but.
Oh, okay, I'm sorry. Yeah.
But
kind of the same thing.
Yeah.
2 points of clarification. Sorry, 1 point of clarification. But evidence-based in this just means that there's peer-reviewed scientific literature supporting the efficacy of a given procedure. It's a way to not have yoga not just yoga, but like for alternative medicine programs to be covered under this. That's the only distinction there.
Yeah, and I asked about art classes and they said, well, that's not necessarily evidence-based. Well, it might be for people with Alzheimer's and dementia. But once we get the list of things and the procedures, I'll make sure that they're shared with us right away and highlight them so that we can, be thinking about them and, suggesting them, et cetera. And along with that, so they have a program called Grab and Go on the Cape, where people who are 60 plus can pick up produce from local farms. That's an overage. So it was great to see that Bartlett's and whomever does the bread were doing that at the Salt Marsh. So that's something that happens at other senior centers all the time. And it's called a Grab and Go. That's the name of the program. So I don't know whether, we can parlay what Bartlett's did that one time into a Grab and Go program, but that's, yeah.
That's all basically through the food pantry. There's a gentleman, Kelly, who just reaches out to me and say, hey, if I bring this over, can you get rid of it?
I think that's what the Grab and Go program is too. It's
Right.
our overages. So it's good that that's,
So it's not on a regular basis because you don't know how much is going to be left over, but he gets in touch and we put out emails and we got rid of a
That's
lot
great.
of bread and a lot of mescaline greens last week, which was,
That's-
they just kept coming. As Jericho knows, he was here handing them out. It was
I mean,
great.
bring some home, Jericho. I'm 60.
I'm not
I
gonna,
love fresh
He
greens.
was partial to how old the bread was. He did a little touchy
did- I-
feely thing and said,
I have very strict criteria for something natural
Right.
bread. If the,
French toast, man, toasted peanut butter and jelly.
I mean, the toasting is good. I think we still have a loaf of that stuff
Yeah.
frozen in the fridge though. So I
No,
was,
we don't.
we don't?
No.
Okay, do I need to write this down in the minute?
Yes, I think
and
we
then-
need direct quotes of all of this. Specifically, let me spend an hour and a half describing my process for determining if I will take something natural bread or not.
That's okay. And then one other program that they have over there that sounded interesting is they have a pen pal reading over Zoom with seniors and certain classrooms in various schools, which I thought was interesting. And again, they gave us great praise for the reaching out to the homebound seniors for vaccinations. I mean, they're still figuring it out and we've been done for a long time. And I was again very proud, and I don't think I said, oh, my son did that. But everyone on the Cape and Islands knows that we folded that out in record, time and with great efficiency. So that's nice to be lauded a little bit when we do good things. But that's my ESCCI comments.
Thank you, Allison.
You're welcome. Any questions?
And anything that you want from us in attending some meetings about these proposals or RFPs,
Mhm.
I hope you'll just reach out to us if you
I'll,
want.
I'll shoot it to Laura as soon as I get it.
Okay.
And there's one other thing I wanted to mention about our island home. I don't know if you've read the tiny little article, the ads in the newspaper, but the guy who is, let me just get to that. The guy who did that charade, or I don't know what you call it. Did any of you go to those stakeholder meetings?
Oh, yes, our whole committee did.
Yes. So there are a bunch more that the town of Nantucket, let me just get those. Excuse me. That I just am wondering if anyone is going to go to them. I think it was in also the town manager's email that she sent out. Do you guys get that long email that Libby sends out from the desk of Libby Gibson or whatever?
Yeah.
It was the very last thing at the bottom. So unless you went through everything, you didn't see it. But they are looking for the community's input on Our Island Home. And if you haven't been to one of those meetings or know anyone who's passionate about a skilled nursing facility on Nantucket, encourage them to sign up for one of those Zoom meetings, because I think I'm going to sign up for the rest of them just so I can be in the room to hear what people are saying. But I think it's really important that we get as much input from the town as possible for that. So.
Great. Thank you. But you
That's
do
it.
remember our whole committee did go through that.
All right. I mean, I've been to a couple of them and they've all had the same basic feedback at the end. This again?
Yeah, we've been going through it for years now.
Yeah. So,
Thank you very much. I'm the last person and I'm going to take 30 seconds to tell you what the NCEA is up to these days, which is totally focused on improvements to the salt marsh, which Laura has given you the details about. So that's where their money is going this year, and that's just about all they talk about at their meetings. So they have been very busy getting the salt marsh all spiffy for whenever we're allowed to come back into the building, which we're all chomping at the bit for that. But that's the way it goes.
No, bravo. I think that's fabulous. Money well spent.
Yes, it is, for sure. So unless there's anything else on anybody's mind that you want to bring up.
I'll do it for, again, 30 seconds too. I just wanted to put it out there, and I was going to write Laura. If anybody's going off island and needs a ride to somewhere, to a doctor's appointment, to anything, please contact me, because I'm, I ain't working and I'm in my garden and working in the house, but I would be more than happy to be a taxi driver or an Uber or whatever you want, for free. I mean, so if anybody knows of anybody.
Oh, how generous
Yeah.
for that offer.
Yeah, well, I can say no too, so.
Certainly can.
Oh,
Yeah.
Thank you, Kendra.
Yeah, totally. Okay.
So does somebody want to move to adjourn the meeting?
I do.
Ally,
Allison, do I
Yep.
get a second?
I'll second it.
Okay,
Judith?
have to go through the roll call again, sorry. Allison,
Yes.
Diane is gone, Vanessa's not here, Kendra,
Yes.
Jude,
Yes.
Linda must be gone, and Mary Ann, yes. So the meeting is officially adjourned. You can turn off the cameras.
All right. Thanks.
Thank you.
Bye.
See you next month.
Kisses,
Bye.
Kendra. Mwah, 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 mwah.